Well, thank you for being here. And what I intend to do is give you an overview of the vision and the activities of the World Health Organization, and particularly the Regional Office for Europe in this field, and our actions in partnership with NGOs and the partnerships with our member states over the next couple of years. And let's first actually clarify a bit what WHO is about. We are an intergovernmental organization, which means that we act on behalf of our member states, and particularly ministries of health. And here you see the flags, where we have our regional committee every year, the flags of all our 53 countries, from Iceland on one side to Tajikistan on the very other. And it's about 850 million people around the whole region. And the reason we are so concerned at this point about children with intellectual disability, and I'll say a bit more about autism in a moment, is that over the last few years we have been increasingly become aware of how vulnerable these children are and how badly often their support, care and treatment is in many of our member states. And this is a concern for ministers as well. I've talked I remember a ministry in Uzbekistan, in Serbia, and they all acknowledge that they're very ashamed of what's happening in their institutions and would like support and mechanisms to improve particularly the care in these large institutions or on social care homes for children, with often a very mixed population. Public profile is an issue for ministries as well as for us. The press interest, BBC programs, pieces in Le Monde are very powerful in French-speaking countries. And that led to us deciding to take action. And I particularly want to mention here Dame Stephanie Shirley, who is actually the donor of a autism society, who gave us a sizable amount of money so that we could take this forward. And it's again interesting, this interaction between autism on the one hand and intellectual disability and the WHO. But our angle, of course, is different from the angle of many other organizations. We are, of course, the World Health Organization. So our way in to deal with the challenges of care for people, for children and young people with intellectual disability, is the health angle. But of course, health is quite broad. So what we're not purely interested in is treatment of disorders, but is the attainment by all peoples of the highest possible level of health. And that's in our constitution from 1948, and it's still a visionary statement. So it's the highest possible level of health. Health itself is not a right. There's sometimes a confusion about that. It's not health that's the right. It's the highest attainable level of health. You cannot sue your government if you're ill. You can, in theory, and sometimes in practice, sue them when you don't get appropriate, suitable care. And actually, I think Autism Europe has been very effective in that respect on a number of occasions. But what makes it particularly powerful, from our perspective, is our definition of health. And here you can see that health is a state, and this is the WHO definition in our constitution. Health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Now remember, I recently talked to a number of psychiatric trainees, and I asked them for what is the definition of health. The first thing they came up with was the absence of disease. But this is, of course, a far broader vision about what we're responsible for. And of course, particularly relevant at the moment, when there's so much talk about well-being at times of an economic crisis, the social determinants of health, inequalities, vulnerable groups, it suddenly gives WHO a very powerful mechanism of involvement. I also would add that that was probably not the original vision in 1948. We have moved forward very much with these concepts and have broadened it out. And obviously, the link between such a definition and the life of children with intellectual disability or autism is powerful. So, why did we believe at this point that we need to move on as a WHO based on these previous definitions of health? And it's in essence because the strong awareness of the failure of healthcare, the failure of health provisions for CIDs, children with intellectual disability, in European society as a whole. There is no country with not some challenges, although very few countries have identical challenges. It's the barriers, typical human rights statement, the barriers to full enjoyment of the human rights, but within that, the sub-points are really the poor access to treatment and support, and I'll say a bit more about that specifically for this group. The obstacles to develop based on poor health conditions, the discrimination and abuse experienced by many people, many children, either in hospitals or in the community. Again, let's not be naive. Let's not believe that all abuse and neglect takes place in large institutions. There's also neglect and abuse at homes or certainly in community settings. And of course, the other 2 points which are connected, the discrimination suffered by many people, which you're much more aware than I am, and I'm not going to say more about that, but also the exclusion from society. There's this separation in many ways, which again, each of you, no doubt, can give a very convincing presentation about based on your own experiences, either at home or at your work. Now, this is a slide I'm very careful about because it's tremendously controversial in almost every line, and I put it here merely as a number of points which identifies the interface between our work, which is about children with intellectual disability, and your concern, which is about autism or autism spectrum disorder. And the reason why autism is so important for our initiative and why we believe that our program is so important to you is that there is such a big overlap at the center of the curves and such a sense that our agendas are pretty identical, as I touched on earlier this morning. 75% of people, children with autism, have an IQ of less than 70. And again, I don't want to go in a debate precisely what it means, but clearly there is a massive overlap, anyone will agree. Many children with intellectual disability have autism, whatever that means in some situations. But many of the phenomenology, the signs and symptoms of autism, one finds particularly in children with severe intellectual disability. But the last 2 points, I think, are incontroversial. There are a large number of children with untreated autism in these institutions, many European countries, who are neither diagnosed nor treated. When one walks into these institutions, I once walked in there with a psychiatrist specialized in autism, and she sort of could pick them out. All these children with autism were sort of sitting there, not receiving any specific treatment. And in that sense, our agenda, I think, is identical. Unless we first do need assessments, unless we first diagnose children, it is meaningless in many countries to implement sophisticated programs for autism only, when in practice they're all mixed up together. Now, let me give you some facts and figures, which are actually very difficult to give, because we do not have very many, and we're not very sure about the reliability of these figures. But when we look now at all these children with disabilities in institutions, many with intellectual disability, including autism, there are no specific data available for children with autism in most of these countries. We know that more than 1.5 million people with disabilities in Europe live in residential care, and the majority of those include intellectual disabilities. And 70% of these 1.5 million people live in services with over 30 places, so small or large institutions. And what we also know is that at least 317,000 children with disabilities in the region live in institutions, often for life. So those are quite striking figures. But what I also can show you, and you're punished here for sitting at the back if you can't read it, is the tremendous variation in rates. These are the children with disabilities in institutional care. The first line is the rates per 10,000 of the relevant population in 1990, the second one in 2002. Two things to observe here. First of all, the perplexing variation across countries, which can be due to a number of factors, including alternative provision, but not between many of the middle-income countries. And secondly, the changes from the left in 1990 to 2002, which is again not always going downwards. In some countries it's going upwards. A massive drop in Lithuania from 80 to 47. But then, of course, it was extremely high to start with, and is still high medium at this point in time. Moldova, the same direction. But you can see that it's quite inconsistent and actually still quite high. And these are children with disabilities, but the majority of these are children with intellectual disability, including a certain proportion, unknown proportion, with autism. So there is already a big agenda staring us in the face, which is that institutional care is still very much used, but inconsistently so. And when there is diversity, there is on the whole a good reason to act. So, based on this introduction, what are the aims of the World Health Organization? First of all, our aim is to ensure that all children and young people with intellectual disability are fully participating members of society, integrated in the community, and receiving appropriate healthcare and support proportional to their needs. It's not a statement that will surprise you, but it's important, and it's important because we put it forward to our member states. But of course, this is fully in line with conventions and previous declarations.